Recording.
Good afternoon, everyone. My name is Valerie Moreno. I'm a case manager for St. Barnabas Senior Services Family Caregiver Support Program. Today, we're going to be discussing urinary incontinence. I would like to introduce you to our family caregiver support team, Olga Yamawaki and Michelle McGuire. Once again, we're going to be discussing urinary incontinence. What is urinary incontinence? Normally, muscles in the bladder tighten to move urine into urethra, and muscles relax to let urine pass. Incontinence occurs when muscles in the bladder relax without warning. Involuntary release of urine, urge to urinate and can't make it to the restroom, common with aging and older adults. Causes of urinary incontinence. Some of the causes are weak bladder muscles, overactive bladder muscles, weak pelvic floor, damage to the nerves, and blockage from enlarged prostate. Some of the symptoms of urinary incontinence include leaking urine during daily activities, such as coughing, sneezing, laughing, exercising, or lifting heavy objects, leaking urine without warning or urge, sudden urge to urinate, not being able to reach the bathroom in time, bedwetting during sleep. Some lifestyle factors include obesity, bladder infections, alcohol consumption, smoking, caffeine intake, acidic foods, spicy foods, aging, and certain medications. Some health conditions that can impact urinary incontinence include Alzheimer's disease, Parkinson's disease, multiple sclerosis, diabetes, anxiety, spinal cord injury, or problems with the nervous system. I'm going to be discussing the different types of urinary incontinence, and one of them is stress incontinence, which is urine leaks due to increased abdominal pressure. For example, coughing, sneezing, laughing, exercising, or lifting heavy objects. Body movements that add pressure to bladder, most common in younger, middle age, or older women, common in women who've had multiple vaginal births, experiencing menopause or loss of muscle tone. Urge incontinence is a sudden urge to urinate and cannot hold urine long enough to make it to the restroom. Involuntary urine leaking during inappropriate times caused by abnormal bladder contractions. Bladder might not be functioning because the nerves are damaged due to health conditions such as MS, diabetes, stroke, dementia, and Parkinson's disease. Another type of urinary incontinence is overflow, which occurs when the bladder is full, which increases bladder pressure to higher level than urethral resistance, resulting in small amounts of urine to leak. It is accompanied by weak urine stream. Urine is frequently leaking because bladder is not completely empty. It may be a result of a tonic bladder, meaning muscles are not contracting or sending a signal to your spinal cord. It also may be a result of a diabetic neuropathy, spinal cord injury, or prostate gland enlargement. Functional incontinence. This occurs as a result of an inability or unwillingness to get to the restroom. A person cannot move quick enough, problems with thinking or communicating, such as Alzheimer's, due to physical limitations, mental impairment, depression, or bed confinement, dependence on caregiver for toileting assistance. One example is the person may have arthritis and they cannot unbutton pants or pull their pants down, or the person may be in a wheelchair. I mean, they need assistance from their caregiver to use the restroom, and maybe the caregiver is, preparing lunch and they're unable to call them, and they have an accident. Seek medical advice. Incontinence can be difficult to discuss and can negatively impact quality of life. Discuss incontinence with your doctor because they can help you find a solution. Bladder control problems are normally a side effect of another health condition, and a doctor can discover underlying condition. How is urinary incontinence diagnosed? One of the tests that doctors usually use is urodynamic testing, which measures how the bladder and urethra store and release urine. Another test is post-void residual urine test that measures how much urine is left in the bladder after voluntary void. Bladder stress test, it checks the bladder if it leaks when you laugh, sneeze, cough, or exercise. Urine culture, it checks the urine for germs, bacteria that can cause urinary tract infections. And lastly, x-rays or ultrasounds, they can check the position of your bladder and urethra. Here are some treatments for urinary incontinence. Behavioral strategies such as timed urination, pelvic floor exercises, most commonly known as Kegels, changes in lifestyle and diet, medication, medical devices, and surgeries. Urinary incontinence and Alzheimer's disease. Individuals with Alzheimer's often have urinary incontinence. Message between the brain and bladder is not properly working. Not being able to recognize the need to urinate, forgetting where the bathroom or toilet is located, loved one forgot how to undo clothing, limited mobility, not being able to communicate to caregiver that they need to use the bathroom, loved one does not understand verbal prompts from caregiver that it's time to void. Here are some caregiver tips for urinary incontinence. Have regular doctor visits with your loved one. Ensure loved one has a healthy diet. Avoid caffeine, spicy food, chocolate, and sweeteners. Ensure loved one is wearing clothes that is easy to get on or off. Pack a small bag with extra clothes, wipes, and incontinence products. Have empathy for your loved one if they have an accident. Don't become angry. Leave the bathroom door open. And here are some tips that are continued. Increase bathroom safety. Schedule regular trips to the bathroom. Prevent overnight accidents with washable absorbent bed pads and disposable underpads. Consider a commode by loved one's bed. Use incontinence products for leak protection such as pads or briefs. Consider a waterproof mattress, sofa, and chairs. Use sanitizer or odor eliminating products on furniture and room. Lastly, to conclude, here are some tips for general urinary incontinence supplies. There's disposable undergarments such as underwear and briefs, pads, liners. There's also bladder control guards for males, male shields, bed pads, which are known as chucks, bedside commode, or consider ointment to avoid any rashes. And that will conclude my presentation. Here is my works cited page where I got all of my articles and information from. Thank you so much for participating in today's presentation for urinary incontinence. And lastly, we're going to open it up for questions, comments, and feedback. Does anyone have any comments or questions? If not, this will conclude the presentation.
It's interesting. I like 90% of my clients have, the care recipient has incontinence issues to some degree.
Yeah.
And it may just be because our clients tend to be older adults, and with aging, it happens. I mean, I would think a lot of our clients, not only our CRs, have, are starting to have issues with incontinence, right?
Yeah, it increases the chances with aging. Yeah.
Yeah.
Yeah, it was good information. And I know a lot of our clients too who depend on a lot of the incontinence supplies,
Yeah.
or especially at night, during nighttime.
Yeah.
It's true. That's probably one thing that we provide the most of, aside from respite, is incontinence supplies.
Yeah, that's very true.
So
Yeah,
it's
which
definitely-
are kind of expensive, you know. for-
Yeah,
Yeah. For someone who's on a limited income and has to depend on those supplies, it can become very pricey very fast.
You know, what might be another good presentation to follow up this one is if we can touch base with our clients when we're talking to them and find out specific issues that they're dealing with. And we could talk about those specific issues and maybe ways to deal with them, or, you know, just
yeah,
work with that information somehow. That might be nice,
yeah, that sounds like a good idea.
since so many of them are dealing with it. Okay, nothing else. I'm going to go ahead and stop the recording.